What are some ways we can soothe arthritic pain?
So trying to keep yourself as mobile as possible. So in the case of hands and knees and hips, things that are already in motion tend to stay in motion. So a lot of people will complain with arthritis, whether it's rheumatoid or any sort of inflammatory, or just run-of-the-mill degenerative osteoarthritis. Keeping in motion is really the thing that feels best, because once you slow down and let everything kind of lock up, it's a lot harder to overcome that initial moment of movement, and that's the most painful thing to really push past. So keeping people moving is really the thing that we always stress the most. Obviously within reason and within limits. There are, especially in the hand, like in the thumb, very frequently people will get arthritis at the base of their thumb, like kind of right at the bottom. And although usually your hand is able to do kind of all of these like, fun motions, sometimes it just gets kind of stuck here, in that position. And there's no way you're going to get it back to go flat again. It's just not going to go. So kind of living within the boundaries of what your body is defining for you, but not stopping completely is really key. And to that end, staying warm. The winter tends to be really harsh on arthritic joints. People get very, very stiff. There's pressure changes in the atmosphere, and that causes a lot of inflammation and discomfort. So talking to your doctor about things you can do from an anti-inflammatory standpoint. So, some people do really well with anti-inflammatories like Motrin or ibuprofen, Aleve, naproxen, things like that. But obviously that's not right for everybody. If you have any gastric issues, any kidney issues, there's a whole host of reasons why you can't take these medications. So that's always something to discuss with your doctor before you kind of embark on that on your own. But keeping warm, keeping moving, and then, like I said, a lot of modifications. So just modifying how you do things and finding a slightly different way to do it will keep you comfortably moving within the limits of what your body is telling you is okay.
Got it. So key factor, listen to your body.
Listen to your body. I think more than anything, for just about everything, the answer is be mindful of what your movement is, and be mindful of what the feedback that you're getting from your body is. Being sore after a workout when you haven't been to a gym in 3 years is totally normal. Being in agonizing pain while you're trying to actively do something while you are presently at the gym is probably not normal, and you're probably doing something to damage yourself. So you don't want to cause an injury by pushing through things unless someone's told you like, this is normal, that's okay, you can push through. But yeah, just being very, very mindful, and then discussing, what your thoughts, you know your body better than anybody. So coming to your doctor and saying, listen, I've tried doing this and this seems to work for me, but I want to make sure I'm not doing it wrong. Or I've tried this medication and it works well for me, but I don't want to take something that's going to hurt me. Those things actually provide a ton of insight into how to treat these issues, because the same thing doesn't work for every patient. Different patients respond differently to different things. But yeah, just keeping mobile, keeping warm, trying to keep the inflammation down in any way possible, and being very mindful of what it is that affects your pain levels and your discomfort is really the key to it.